Spinal muscular atrophy, or SMA, is a rare genetic disorder. It affects the nerves that control voluntary muscle movement. These nerves are called motor neurons, and they are located in the spinal cord. In SMA, the motor neurons deteriorate. This deterioration leads to progressive muscle weakness. SMA is a serious condition. It can affect individuals of all ages. Infants, children, and adults can all be affected. The severity of SMA varies widely. Some individuals experience mild weakness, while others have more severe symptoms. SMA is not contagious, it is an inherited disorder. This means it is passed down through families through genes. Understanding SMA is the first step in raising awareness and supporting those affected. Spinal muscular atrophy, or SMA, is caused by mutations in a specific gene. This crucial gene is called the survival motor neuron 1 gene, or SMN1 for short. The SMN1 gene provides essential instructions for creating a vital protein. This protein is absolutely essential for the survival and proper functioning of motor neurons. When the SMN1 gene is mutated, it cannot produce enough functional protein, leading to severe consequences. Without sufficient levels of this protein, motor neurons begin to die off gradually. This neuronal death leads to the muscle weakness and atrophy that are characteristic of SMA. Interestingly, there is another gene called SMN2. SMN2 is very similar to SMN1 and can produce a small amount of the needed protein, though not as efficiently. The severity of SMA is often related to how well the SMN2 gene can compensate for the faulty SMN1 gene, influencing the overall impact on the patient's health. SMA, or spinal muscular atrophy, is classified into different types. These types are based on the age of onset and the severity of symptoms, which can vary significantly from one individual to another. The most common types are SMA type 1, SMA type 2, and SMA type 3, each with distinct characteristics and challenges. SMA type 1, also known as Werdnig-Hoffmann disease, is the most severe form of the condition. Symptoms of SMA type 1 usually appear before 6 months of age, often causing significant concern for parents. Infants with SMA type 1 have difficulty swallowing, breathing, and controlling their head movements, which can lead to serious health complications. SMA type 2 typically onsets between 6 and 18 months of age, presenting a different set of challenges. Children with SMA type 2 may be able to sit without support, but will have trouble standing or walking independently, often requiring assistive devices. SMA type 3, also called Kugelberg-Willander disease, usually appears after 18 months of age and can affect mobility. Individuals with SMA type 3 can walk independently, but may experience muscle weakness and fatigue, impacting their daily activities. In addition to muscle weakness, other common symptoms of SMA include breathing difficulties, scoliosis, which is a curvature of the spine, and joint contractures or stiffness in the joints, all of which require careful medical management. Section 4. Diagnosing SMA. Diagnosing SMA usually involves a combination of medical history review, physical examination, and specialized tests. Doctors will ask about family history of SMA and assess the child's motor skills. Genetic testing is the definitive way to diagnose SMA. A blood sample is taken from the individual and analyzed for mutations in the SMN1 gene. Another test used in diagnosing SMA is electromyography, or EMG. EMG measures the electrical activity of muscles and can help determine if muscle weakness is due to a problem with the nerves or the muscles themselves. Section 5. Treatment and management of SMA. While there is no cure for SMA, there are treatments available that can help manage symptoms, improve quality of life, and slow down the progression of the disease. These treatments are tailored to the specific needs of each patient, ensuring a personalized approach to care. Treatment options for SMA have advanced significantly in recent years, offering new hope to patients and their families. Gene therapy is a groundbreaking treatment for SMA. This innovative approach targets the root cause of the disease at the genetic level. It involves delivering a working copy of the SMN1 gene to the motor neurons, which are crucial for muscle movement and strength. This helps the motor neurons produce the essential protein they need to survive and function properly, potentially halting the progression of the disease. Another type of treatment involves drugs that target the SMN2 gene. These drugs are designed to increase the production of the SMN protein from the SMN2 gene, partially compensating for the faulty SMN1 gene. By boosting the production of this critical protein, these medications can help improve motor function and overall health in patients with SMA. In addition to these specific treatments, supportive care is crucial for individuals with SMA. This comprehensive approach addresses the various challenges faced by patients. This includes physical therapy to maintain muscle strength and flexibility, which is essential for mobility and independence. Respiratory support to assist with breathing difficulties, ensuring that patients can breathe more easily and comfortably, and nutritional management to ensure adequate calorie intake, which is vital for maintaining energy levels and overall health. Together, these treatments and supportive measures can significantly enhance the quality of life for those living with SMA.